Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi guys, welcome back. I'm so glad you're with us today. Today we have a special guest. Her name is Dr. Kaitlin Stein, and she is a mom and a wife and also a pediatrician. And she has been practicing in Kansas City for 4 years as a pediatrician, doing acute care visits, which you may know of as sick visits. And so she is an expert in sick visits, and she's going to share with us her knowledge on how to navigate this antibiotic versus no antibiotic versus virus versus bacterial infection. So with that, let's get to Kaitlin.
Thank you so much for having me. I'm really excited for this conversation.
Yes, so we're going to be talking about, being sick as a kid and having a kid who's sick and then how to treat it. So I'm so excited about this topic and the use of antibiotics. So tell us, what is the difference between a viral illness and a bacterial illness?
Yeah, that's a really great place to start. So both viruses and bacteria are microscopic things that make us sick. The really challenging thing is that they can both cause really similar symptoms. So it can be hard for parents to know whether their kid is sick with just a typical virus or a bacterial infection that would need specific treatment. There are some kind of scientific differences between the two. Bacteria are actually alive, so they can exist in our environment around us and in our bodies, whereas viruses are not actually alive. They require a host to live in, like a person or an animal, to then multiply and spread through the community. Since they differ in their structure and their function, they also differ in how they're treated, but we will get into more of that later.
Yeah. Okay, cool. So they're really a different entity. Like when we look at them on the microscopic level, they're totally different.
Exactly. Yep.
Yeah. And that's important to know because you wouldn't treat it the same if it's a totally different thing.
Exactly.
Okay, cool. So when do you think sick kids should be seen by a doctor? Because sometimes this is hard as a parent. We're like, okay, how many days do we have a fever? Or how high is the fever? When are the times that we should bring our kids in?
Yes, that's a really great question. So, my first rule for parents is if you know your kid best. So, if you're worried about what your kid's looking like or how they're acting, just go ahead and bring them in to be seen. No doctor is going to question you for bringing your sick kid in. We want to help you and give you guidance in how to best take care of your kid and make sure there's nothing bigger going on. There are some key features of illness that should definitely prompt a parent to bring their kid in. You touched on the first one, so fevers. Fevers are a hot topic. Depending on who you talk to, or outside of the medical community, they may give you a different number. But in the medical community, we'll call a fever anything of a value of 100.4 or greater Fahrenheit. So if your kid has been sick with a true fever for more than 5 days, they absolutely need to see a doctor. A virus should not cause a fever for more than 5 days. Often I'll tell parents of younger children, like our babies and toddlers, that if they've had a fever consistently for more than 3 days, go ahead and bring them in. They have trouble expressing their symptoms. And so it's worthwhile to get them checked out a little bit sooner if they're really having those consistent fevers. The other really important thing to know about fevers in the setting of virus versus bacterial illness, if you have a viral illness, a fever is going to come in the first couple days. So don't be surprised if your kid starts having runny nose, cough, fever all at the same time. That's probably just the virus. But if you start having a fever more than 2 or so days into the illness, there's a chance that maybe your child has something more going on. When kids are sick with viral illnesses, it leaves them more susceptible to developing a bacterial infection. We call it a secondary bacterial infection. And that's something that's developed on top of their virus. So if a fever is coming later in the illness, it may be a sign that they actually have a new bacterial infection on top of that virus they have. Some really good examples of that would be ear infections, sinus infections in our older kids, pneumonia.
Okay.
The next thing I always tell parents is if your kid's sick and having breathing issues, like you're watching them breathe, they're breathing really rapidly, or it looks like they're having trouble breathing, like they're using the muscles of their chest to breathe, their head is bobbing because they're using their muscles of their neck to kind of pull their chest open, they're grunting with each breath. Those are all things that would be signs that your kid should be seen right away. Kids can wear out quickly, especially our littler kids. So that's always a reason to be seen. The third really big thing I'll tell parents to come in for is if your kid really isn't drinking well. A kid's not going to eat well when they're sick and probably not going to drink as well either. But I tell parents, don't worry if they're not hungry. I'm not hungry when I'm sick either. And they'll have reserve to, maintain their blood sugar and things, even if they're only drinking. The challenging thing is when kids are really not drinking well, they can become dehydrated and need more support. So if your kid's not peeing once every like 8 hours or about 3 times a day, that's a sign they should be seen. Some other kind of smaller things, but important things to watch for is like if your kid is lethargic. Parents like to use the word lethargic, but true lethargy is your kid's hard to wake up. They're difficult to arouse. They're not acting themselves. So if that's the case, bring them in. If they're inconsolable, really uncomfortable, fussy, especially those littler kids who can't tell us how they're feeling, bring them in too. Maybe something's hurting and they can't tell you, but we can find it on their exam. For our older kids, if they can say like, this hurts, like this ear hurts, or this part of my tummy hurts, or my throat hurts really bad, go ahead and bring them in too, because that might be a sign that we need to do something more too.
Yeah, those are good rules to kind of follow. So can I ask you a follow-up question? Why do we get fevers? Like, why does a fever happen?
Yeah, so that's a really great question. I have parents ask this all the time. A fever is just a natural response to an illness, whether viral or bacterial. When your immune system senses something foreign in its body, like a virus or a bacteria, it releases these little communication signals called cytokines that can trigger our body to mount a fever. The really interesting things, and parents will say this all the time, is like, my oldest kid always spikes a super high fever every time they're sick, but my little one can be sick, horribly sick, and they never spike a fever. Everyone's immune system is different. So some people may just produce more of those cytokines or be more likely to spike those fevers than others. But consistent true fevers of that 100.4 can be a sign that there's something bigger going on, even in those kids who don't tend to spike.
Yeah, absolutely. Okay, so what are antibiotics? So we all hear about them and we know that sometimes they're really useful to help our kids or ourselves get better, but like what are they and how do they work?
Yeah, so antibiotics are a type of medication that's designed to disrupt how bacteria work. So some will disrupt the kind of wall around or membrane around the bacteria. Some will disrupt how they multiply and divide. So they can either kill them or just prevent them from becoming bigger or multiplying. There's a lot of different classes of antibiotics. So that's why your kid, you may get, amoxicillin for this illness and ceftonir for this illness and Keflex for this. Each antibiotic works in a different way to kill bacteria. So in medical school, doctors will learn, which types of bacteria are the most common causes of certain illnesses, and also which antibiotics work best for which bacteria. So this helps us decide, okay, this kid has an ear infection. This is the right starting antibiotic for that. Or this kid has a skin infection. This is the right antibiotic to start for that.
So we were just kind of talking about this, but what common childhood illnesses do require antibiotics and what ones don't?
Yeah. So since we're kind of talking mostly about like these, the virus versus bacterial discussion, I like to kind of focus on respiratory illness because that's really going to be our hot topic through the winter months and fall months for kids. So the things we think about most as far as bacterial illnesses in kids in respiratory season would be like ear infections, pneumonias, sinus infections, those sorts of things. Most illnesses that kids have in the wintertime are just viruses, like the common cold virus. And a virus is just going to get better on its own over time because our immune system is going to fight it. When kids, like I said before, when kids are sick with viral illness, they're more susceptible to developing those secondary bacterial infections like the ear infections, pneumonias, sinus infections. So those would actually warrant treatment with the antibiotics. Like I said earlier, too, it's hard to differentiate as a parent which your kid has, but based on the history a parent gives us and what we find on the physical exam, that can help us identify the kids who have those bacterial infections and actually need antibiotics to get better. Some other types of bacterial infections that kids will get treated for commonly just in like the pediatric clinics would be things like urinary tract infections, strep throat, skin infections, things like that. But those may come completely separately from, when a kid is sick with a virus.
Yeah. Yeah. And they can be something, I know, like I cut my finger one time and I had gone and worked out at the gym and then my finger was like so painful. Yes. I was like, I think I have an infection in my finger. And I did.
Exactly.
So then I needed some type of antibiotic ointment in that case. So not oral, but an ointment to put on. So we have lots of different ways that mechanisms of getting that antibiotic to the place.
Exactly.
And sometimes it's really important to have that right method, because that helps us to directly impact that bacteria, right?
Exactly. And we as pediatricians love it when we can avoid using oral antibiotics for side effects and things like that I'll get to a little bit later. But if we can treat a skin infection with something topical and avoid those side effects and achieve the same effect, then we're very happy.
Yeah.
Again, like we said, sometimes parents get discouraged when antibiotics aren't prescribed for an illness. But in that case, it's actually a huge win.
Yeah, I think it's hard to see because we want our kids to get better. And so
Yeah.
sometimes we have this impression that the
Mhm.
thing that is going to help our kids get better is antibiotics. But that's
Exactly.
not the only way. So like, let's say a kid has a viral illness and they don't need antibiotics. What are things that we can do at home that are more like over the counter kind of things to
Yeah.
help our kids get better?
Yeah, perfect. That was a perfect segue into this discussion. Yeah. So when a kid is sick with a virus, we really want to focus on keeping them comfortable. There's a lot of supportive cares we can give kids at home that aren't actual medicine, that can target their symptoms and make them feel better while their own body is fighting the illness. So step one, I always tell parents, make sure to keep your kid well hydrated. Again, I said sometimes they won't drink as well. Sometimes you have to sneak in fluids, popsicles, jello. I like to call those like hidden fluids. And
Yeah.
just frequent sips throughout the day can help kids stay hydrated, even if they're not drinking several ounces at a time. The benefit of being well hydrated, number one, you feel better, but it also can help keep kids like nasal and oral secretions thinner, so they're easier to handle. A lot of kids, aren't effective at coughing things up, but they can cough and swallow and clear their airways that way. So the thinner the secretions, the better. Another way to get that same effect is to use a cool mist humidifier to also
Mm.
keep those secretions thin. The more humidity there is in the air, same with like steamy showers, the more humidity in the air, it thins out those secretions, makes them easier to handle. A lot of kids will feel more congested or cough more overnight, which is really frustrating for the kid and the parent because no one's sleeping. So I always recommend, if you're going to use a humidifier, the prime time to use it is when they're sleeping. Keep it close to their bed, make it like a little steam room in there, so that hopefully they're handling those secretions better while they're sleeping and less likely to wake up from cough. For our older kiddos, so kids 1 and up, they can actually use honey as a really good, safe, and effective home remedy for cough. Um, Unfortunately, kids under 1 aren't eligible due to risks involved with honey in kids under 1. Um, a lot of kids, their main symptom during a cold will be really bad nasal congestion. So for our littles, like our babies and our toddlers, I recommend using saline drops or mist that we can actually put right into the nose and then sucking all that gunk out with a device like a nose Frida, or now they make these really cool like battery powered snot suckers. I use that for my son all the time. It's like a little snot vacuum. I love it.
I
So
love that. Yes.
those are really effective at clearing that airway. And for the little kids, they really like to breathe through their nose. So if we can suck all that out, they can breathe better when they're sleeping and eating, especially our babies taking bottles and things like that. It's going to make them feel a lot better. For the older kiddos, they can actually, if they're willing, I recommend trying a nasal irrigation, like with a neti pot or something like that. It's kind of a tough sell on those like later school age kids, but our high schoolers are usually able to do that to clear out all that gunk, and it makes them feel a lot better. Um, Otherwise, for like fevers, pain, things like that, absolutely, I'll tell parents to use Tylenol and ibuprofen as needed, as long as they're giving a safe dose that's safe for this child's size and age, and they're not giving it too frequently. It's really safe to use those medications, especially early in the illness when they're uncomfortable. Caveat to that being, children under 6 months can't have ibuprofen, but otherwise, you're free to use those. All the parents will ask me, when can my kid use the over-the-counter medicines like the Delsum, the Robitussin, those sorts of things? As a general rule, I like to say 6 years and under, don't even bother buying those things. Use the supportive cares that we've already talked about. Maybe I'm a little young and nervous still. I tend to say for like 8 and up, I'm excited about using the over-the-counter products, but technically 6 and up is fine to use the over-the-counter things to try to target symptoms, as long as you're using it as directed on the packaging.
Yeah, that makes sense.
Yeah.
I mean, it's hard. It's so hard because it's like you want your kids to sleep and like you're probably tired because you're taking care of your sick kid. And so then it's like, and you want them to get better. And so sometimes we feel like medicine is going to make it be the
Right.
thing to get them better. But what
Exactly.
I hear you saying is really it's about, yes, keeping them comfortable,
Mhm.
but that it's also about just letting their body do what it's doing.
Yep, exactly. The body's going to take care of it. And there are going to be other signs to watch for, like we talked about before, that there's something more going on where maybe they do really need something more.
Hmm.
But most cases, kids are going to get over it on their own. It's going to be a rough like 5 to 7 days, and then they should just gradually get better over another week or two.
Yeah. And I think this might have been you, but somebody told me once about coughs and how like your kid could be better, but their cough could last for weeks and weeks and weeks after their
Yes.
illness.
Absolutely. This was actually really interesting. Last winter, we saw there was something going around the Kansas City area. And me and one of my colleagues who were doing all the sick visits were in our office talking about, are you seeing these kids who are coughing for like over a month? Like even our big kids, they're coughing for, 6 to 8 weeks, and they feel great and they're doing their sports, they're going to school, they're fine. Their parents are just tired of hearing them cough. And I would be too. I would be sick. And as a kid, I'd be sick of coughing too, but they're totally fine. You can have a post-viral cough. And I usually tell parents, like, if your kid's still coughing really bad after a few weeks, it's probably worthwhile, especially if it's impacting their activities. It's probably worthwhile to just come in and get them listened to, even if there's nothing else that's alarming about how they're doing. But oftentimes at those visits, I take a listen. Their lungs are totally clear. There's no sign of anything more going on, and we just wait it out.
Yeah,
So,
which could be hard, but it's good to know. Like
yeah.
information is kind of powerful. And so I
Yeah.
think, I remember as a new mom, it was like everything made me nervous
Mhm.
about them, right? And then my poor fourth kid, it's like, I'm like, you're fine. We're going to get through this. Like,
Yes.
here are the things. But I think the more we get comfortable with that idea of like, we don't have to have a medicine that like keeping things moist is good. And then
Yes.
also, just like watching for symptoms, keeping comfortable, keeping hydrated, like all of those things are what's going to help us get through those viral illnesses.
Exactly. The
Yeah.
other really challenging thing too is with those little kids. I'm a mom of a toddler, so I've experienced the daycare sniffles. And my kid, I told parents all the time, I'm in the same boat as you. My kid's been coughing. It was May, and I'm like, my kid's been coughing and sniffly off and on since like December 1st. So it's really hard too to know, like, when does one illness begin and end and another one begin, because they can just be this roller coaster of like, okay, we're almost better, and bam, they get worse. Are they
Mhm.
worse because it's a new virus? Probably. But it could be they're worse because, they got that secondary bacterial pneumonia, and that's why they're coughing worse. So it is kind of, I mean, again, it's really hard to know, am I just sick with a virus, or is this something worse?
Yeah.
But typically in those younger kids who are either new to school because they were staying home with mom or a nanny, or those daycare kids who are now exposed to everything from a young age, they can be on this roller coaster of one thing after another. I think there have been studies to show like the average number of viral illnesses the first year in either like a daycare or school setting is like 13.
Oh my
So, a
goodness.
typical one from start to finish may be like a 3 weeks from worse symptoms to totally better. And so basically you get maybe a couple days of good health, and bam, you're hit with another one.
Yes.
So
Oh
it
my
is really
gosh.
challenging as a parent and as a little kid to make it through those winter months.
Yeah. Well, and I know that our kids love to share their viruses with us. And so
Hmm.
then it's also that part of like, I'm just tired of being sick. Can we
Yes.
all just like wash our hands? Can
Yes.
we,
And
right? Like,
especially, yeah, when there's multiple little kids in the same house, especially if one's in daycare and one's in kindergarten and one's in sixth grade, and they're all getting different germs from school and spreading it between each other, it can just be, nonstop.
yes, 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 we definitely understand. Okay, so tell me when we're kind of gonna jump back to bacterial infections and talk about like what kind of things do doctors take into consideration to decide what antibiotic they're going to prescribe, or what, like, does this really need a antibiotic? Does every bacterial infection need an antibiotic?
That's a really great question. So once we've heard the story and examined the child and determined we feel like there is a bacterial infection that needs treatment, we're going to take a lot of things into consideration. So first thing we're going to think of is, what infection is this? Where is it in the body? Because certain types of antibiotics work best against certain types of infections and the bacteria that cause them. So like I said before, we would choose a really different antibiotic to treat an ear infection than we would a skin infection, because different bacteria tend to invade like our respiratory mucosa and inner ear compared to our skin. So that's kind of going to guide us to which class of antibiotics to use. And then when we're just trying to determine like how long, what dose, really more so how long, I guess, Then we think of how old is this kid? Younger kids often will need a longer course to treat infections. In particular, like ear infections is a really good example of this. Kids under 2 tend to need more like 10 days to treat it, whereas our older kids may need more like 7. Some of the older kids, even the evidence will show only needs 5 days. So we'll kind of take the age of the kid into consideration. We also will take into consideration the severity of infection because the more severe the infection is, that may indicate that we need a longer course too. In our little kids who are more likely to get sick with back-to-back things and more likely to get back-to-back bacterial infections, we also want to consider, have they been on antibiotics recently? My kid was a kid who got back-to-back-to-back ear infections until he got his ear tubes. And I think that's probably the most common back-to-back infection we'll see in the little kids. When a kid is sick with, an ear infection and they were just on antibiotics a month ago for an ear infection, we worry like, maybe this new ear infection isn't actually something completely new. Maybe that last infection was not fully treated. The bacteria knocked it down, or the antibiotics knocked it down, took care of those weaker bacteria, but there were some stronger resistant ones that were left behind and have revved back up to cause kind of the same infection, but worse. So in that case, we end up escalating to something stronger or more broad spectrum to make sure we really take care of this infection. So if your kid's been on antibiotics within about the last month or so, I'm probably going to choose something stronger this time to make sure I really treat the infection well. The last thing I'll think about is if your kid, this kind of goes without saying, but if your kid's had an allergic reaction or an adverse reaction to an antibiotic, I'm not going to use that one. I'm going to choose a different class of antibiotics to make sure your kid doesn't have any, worsening because of the antibiotic I choose.
Yeah. On that topic, what can a reaction to an antibiotic look like?
Yeah. So I've never seen it in practice, but the most severe type would be anaphylaxis, which would be like a life-threatening emergency where a child can't breathe or is getting swelling in the face. Never seen that, thank goodness, but it can happen. The most common thing we'll see is a drug rash, and often this is a very interesting topic and could have a whole discussion itself. But it's not even when a kid first takes the antibiotic. It's very late in the first course, or even maybe in the second time they're on that antibiotic, that they'll break out in this body-wide rash. But the rash, it's interesting because there's a spectrum of types of adverse reaction rashes. Some that are so much less severe that it's hard to say whether or not we should really limit a kid from using a whole class of antibiotics because of it. But there are more severe ones associated with fevers and joint swelling and more severe reactions where we would definitely avoid those antibiotics down the line.
Yeah. I mean, it's good to know. And I think, as parents, sometimes we're like, I don't know, we feel like, okay, I already went to the doctor. Like, I don't want to bother them again. But like, if something new comes up or your kid is on antibiotics and you're like, oh, we have this rash, like all of a sudden they woke up and they have a rash, like all over their body or all over their tummy or whatever, it makes sense to call and say, hey, this is what's happening. Do we need to be seen? Right?
Absolutely. I love, number one, if there's a rash, take a picture of it because rashes can come and go. A reaction to an antibiotic probably isn't going to go away until you stop the antibiotic, but it's helpful if it did come and go away, then, and you have a picture of it and now it's gone, but they're still on the antibiotic. That's going to help us say like, okay, no worries. The antibiotic's not causing it. The hard thing is a virus itself can cause really similar rashes, the actually like identical rashes. So it's really the story and the pattern and when the rash comes on in relation to when you started the antibiotics, that's going to guide us to whether or not it's really related. If we're in doubt, especially me, if I'm in doubt, I'm probably just going to say, let's switch to something else. Let's mark it for now. Let's try it again in the future when they're older and able to communicate their symptoms better. And, maybe, or even do like a formal test with an allergist down the road. Because hopefully I don't want to restrict a kid from using a whole class of antibiotics. So if we can prove that they don't have an actual reaction, I would love to get them, that off their allergy list so they can use it again.
Yeah, absolutely. Okay, so what are the risks then of using an antibiotic for a virus? Or I hear physicians oftentimes saying like, make sure you finish your antibiotics. So these are kind of a two-part question, but so what's the risk of using an antibiotic for a virus?
Yeah, that's a great place to start. So when patients have a viral illness and are prescribed antibiotics, like I said, viruses and bacteria are completely different entities. So if you give antibiotics to a person with a virus, it's not actually going to make them any better. In fact, it might make them feel worse. So 1 in 5 kids will actually have some sort of side effect from an antibiotic. The most common ones, like I said, rashes is a common one, but diarrhea, stomach upset, nausea, vomiting, tummy aches, those are really common side effects with antibiotics. And if your kid already feels cruddy, you don't want to make them feel cruddier with these side
Mhm.
effects. So we try to limit our antibiotics to when we really feel like there's bacteria that need to be treated and we feel like the antibiotics will actually make the kid better. There's actually really good evidence now, or growing evidence, to show that frequent use of antibiotics can actually lead to more longer term adverse health outcomes. When we give an antibiotic, we're trying to kill the bad bacteria that are causing our infection. But if it's killing good bacteria, or we're giving it when it's not actually needed, and it's just killing the good bacteria in our gut, it disrupts that environment in our gut called the microbiome. And when we kill off that good bacteria and our gut microbiome is disrupted, it can lead to things like inflammatory bowel disease, like Crohn's disease, ulcerative colitis, obesity, eczema, asthma. There's really growing evidence that it can affect all of those things down the line, which are, things we want to avoid for our kids when they're older.
Yeah, absolutely. And then what happens if you start an antibiotic and you're like, oh, I'm feeling better. They gave me 7 days, but it's 5 days and I'm feeling really good. Why should we
Yeah.
keep taking the rest of those? Or why should we have our kids finish out the whole round?
Yeah. So when we give antibiotics, we often will feel better before the full infection is treated. So you may feel really great after 5 days, but there's still some bacteria that need a couple more days to be fully cleared. Those stronger bacteria, like I talked before, may need that full 7 days. So if we stop early, those stronger bacteria may resurge and get, even more stronger and cause a worse infection, or they may just exist in our environment resistant to antibiotics that we've used. So that's what we refer to as antibiotic resistance, which can be a problem in an individual where their body doesn't respond as well to those antibiotics, but also a bigger issue is like a community-wide problem where certain antibiotics aren't effective against infections for everyone in the community. A really good example of this is MRSA, which is a skin bacteria. Historically, the Staph aureus bacteria would respond to methicillin antibiotics, but because of probably overuse or maybe stopping courses too early, or a lot of factors, that bacteria has become like too strong, I guess, to be treated by the typical antibiotics. Now we have to use much stronger antibiotics to kill those infections. And the stronger the antibiotic, the more side effects, the more good bacteria killed. So it's this spiral of effects that can really lead to community-wide problems. So we want to make sure you complete your full course. So we make sure that we're not breeding these stronger super bugs that won't respond to antibiotics in the future.
Yeah. Okay. So on that, I have a question. So like there have been times where I try to keep track. I saw a mom years ago, or maybe somebody told me, but on the bottle to like mark when I've given the medicine, but sometimes I forget. And my
Mhm.
kid's on antibiotics and it's like, okay, Friday and it's the morning one and we got to like afternoon. Like,
Mhm.
I don't want to miss that dose because I still have that kind of in the bank. How do you handle
Mhm.
that dynamic?
Yeah, so every antibiotic's different. So if you're in doubt, I would say give the dose, but it might be worthwhile to either call your doctor or the pharmacist and say, what is the smallest interval between doses I can give this? Because a
Hmm.
lot of antibiotics we prescribe as twice a day, but if you gave them 6 to 8 hours apart, it wouldn't be dangerous and it would still be effective. I would be lying as a mom if I said that I haven't missed a dose of antibiotic for my son before too. So sometimes if you miss a dose, give yourself a little grace, keep on track moving forward. And then I'll usually tack on that last dose at the end.
Yeah.
If 9 o'clock at night and you're giving the evening dose and you realize you missed the morning dose, you're not going to double up on dose. You're just going to give your kid an upset stomach. So just stay the course, maybe add that extra dose at the very end of the course. But don't get discouraged. When you miss
Yeah.
multiple doses, that's when we get into issues. So I do like
Yeah.
what you said, like marking it. I usually keep on my refrigerator like a piece of paper and I write out the calendar of each dose with a check mark so that my
Hmm.
husband and I can make sure we're not double dipping and giving the dose, twice in a morning, but knowing if the other one gave it or not.
Yeah. Yeah. I think it's hard to keep track, especially when we have multiple humans or a job or
Hmm.
whatever, or just, regular life. And so
Yeah.
it's like adding this one extra to do, and it's very timely to make sure that
Yes.
we get that for our kids is important. So
Exactly.
what do you want parents to take away from this conversation? We've downloaded such really good information and I so appreciate it. What do you want parents to take away?
Yeah. So I think the really big thing is I don't want parents to be discouraged if they go see their doctor and nothing's prescribed at a sick visit. It just means at that point in time, your kid looks good. It's just a viral illness that's causing their symptoms, and antibiotics aren't going to fix anything. The body will take care of it on its own, but your doctor should, in those instances, give you examples of what you can do to make your kid feel better. The things we kind of talked about earlier. They should help guide you based on the symptoms your kid has. What can we do to make them feel more comfortable until the illness has cleared itself? Another important thing, as a previous exclusive sick visit only doctor, I heard this time and time again. I would see a kid and then 3 days later, and I would even warn parents, the things to watch for, to come back for later. And they'd come back later, and I would diagnose them with some sort of bacterial infection. It's not that anything was missed by me or a colleague on that first visit. It's simply initially they had a virus and their body was more susceptible to illness. And now they have a bacterial infection on top of that virus. And they need something more like an antibiotic to help them clear that bacterial component of their illness. So don't be frustrated with your doctors. We're trying to save your kid any of the side effects of the antibiotics and really only giving them when we know it's going to make them better. Yeah. And the last thing is, I know we talked about a lot of the fine details of reasons to come in, and those are all really important things. But again, your child, your child best. So if something's off, even if you can't pinpoint it, just bring them in and see us. That's our job. We're supposed to figure out what's wrong. And you're never wrong to bring them in, even if they're not checking any of those other boxes. They're not having fevers. They're not having breathing difficulties, but they just look off. Just bring them in. We would rather see them and be safe rather than, them come in when they're far too sick and wish we would have seen them sooner. So those are kind of the big three things I want parents to know.
Yeah. Well, thank you so much for your time today. This was so enlightening to hear all of this. And I know it will be helpful for parents to kind of use this as a resource to be like, okay, what's this process about? Which is the difference between the virus and bacteria? And it's hard because it sounds like you guys as physicians are really detectives and you're really just trying to figure it out, and your clues are leading you to different causes or ways to treat. And so as a parent, then it makes sense without that medical school training or specialty that it would be really hard for us to decipher.
Exactly. That's why we go to school for so long. We want to make sure to take care of kids well and give parents the right information to take care of their kids. So it's our job to figure it out. It's not the parents' job.
Yeah, we just know that something's up, and then we let you do your part. So
exactly.
Well, thank you again.
Yeah. Go ahead. I tell parents all the time, mommy and daddy radar is a really good thing. Parents will come in and maybe the symptoms don't seem alarming at all, and I will find something. I'm like, you were right. You were right. There's subtle fussiness and sleep disruption that was mildly, off from their baseline. They do have an ear infection. You were totally right. So mommy and daddy intuition is a real thing. And that's why I tell parents, trust your gut, bring your kid in.
Yeah, I love it. Well, thank you again, Dr. Stein, for all this information.
Yeah, absolutely. This was really fun. Thanks for letting me do this.
Thanks again, Dr. Stein. That was really good information. I don't know about you, but I feel way more prepared for this respiratory season that we're getting ready to go into, to know if we need to check out the doctor's office or if we can stay home and manage it there. With that, I will say thank you so much for your time today. Please rate and subscribe to our show. Follow us on Facebook and Instagram and YouTube, and also keep the emails coming with the requests for topics for episodes to accidentalexperts@gmail.com. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.